Did you know the Cone Health Cancer Center at Penn Hospital can service you for any of your cancer needs right here in your hometown or right here in your county? You don't have to travel anywhere. Well, to tell us all about it, I have Dr. Shannon Penland, the oncologist here, right here at Penn, and we're going to talk about what you can expect if you come here. How are you, Dr. Penland?
I'm good, thank you.
It's nice to meet you, and welcome. You've been here since
December of last year.
Since December, so you're still one of our new docs right here.
Yes.
Tell people what an oncologist is.
So an oncologist is a physician that specializes in treating cancers. We also, however, do blood disorders as well. So we do both blood and cancers, and we provide basically I say we're the primary care doctors of cancer care. We're responsible for following patients through their 5-year period from diagnosis through the end of treatment, and also we are the physicians that provide chemotherapy.
So now that you've mentioned chemotherapy, what can a patient expect when they come to the Cancer Center here at Penn? Can they do the same thing they would if they went to, say, Baptist or Duke or any of the other big, well-known places? What can they receive here?
So I think a common public perception, and I feel very passionately about this because I have many family members who have had cancer and who've had to travel for cancer care. A common public misperception is that they have to travel, or people have to travel to get cancer care. Cancer care is very standardized, and so what I mean by that is there are national guidelines that are used and developed to help make sure that cancer care at Penn is the same as that at Duke versus Baptist versus UNC or versus, down at Wesley Long with my other partners. Breast cancer early stage is treated the same. We use the same drugs. Colon cancer treated the same. And so that's a message I want to get out to the public, that cancer care is the same wherever you go, and you don't have to travel far distances. If you stay in your own community, it's a great benefit to patients from several perspectives. One is it saves them on time, travel time. Number 2 is costs. Number 3 is lost days of work for them or their loved ones. And fourth, also, one thing I'm proud of is that we're small here, and so we get very personalized, individualized care, so patients can access us very easily. And so I think there's only benefits to staying at home.
I agree. When we talked a few days ago, one of the things we talked about was the fact of the extra or excess expense that comes along first when you're first diagnosed. I mean, it's just a lot of folks feel, okay, that's the end of my life, but it isn't.
Right.
It isn't. Cancer is very curable now. But the expense that is incurred when you have to travel to, say, those other big places we were speaking of, and that's not a necessity anymore.
No, it's not a necessity at all. There are times when we have patients, we might want a second opinion, and we will refer those patients to academic centers, but those cases are few and far between. I always offer patients second opinions if that's what they want in order to feel comfortable with the plan that we develop. And 99% of the times patients will go to a larger institution and hear the same thing. And I try to point out to patients too, don't forget that we trained, our community oncologists trained at these institutions. And so, we know how to give the care, and our goal is to give the care at home.
When does a patient see you? Do they see you before they're diagnosed, or do you do the diagnosis yourself?
So I have made myself available to the physicians within the Rockingham County area to be able to help with diagnosis. So if somebody has certain symptoms or abnormal scans and their doctor is worried it might be a cancer diagnosis, I'm here to assist in that. A lot of times patients come to us already after they've had a cancer diagnosis.
Basically for the treatment thereof,
Yeah.
the chemo or the radiation. And so let's talk a little bit about the available treatments here at Penn.
Okay. So obviously we treat all forms of, solid tumors, and what I mean by that is lung cancer, breast cancer, colon cancer, prostate cancer. We treat other types of malignancies, something called multiple myeloma. We also have access to clinical trials. So any clinical trial program or any clinical trial, that Cone Health has, we can offer here. We have social work, we have arts, art healing, we have chaplains. I mean, we have basically everything that you would anticipate you might see at a larger cancer center here for our patients to use while they go through treatment.
What about, I know you do chemotherapy, what about radiation? Is that available here? And several other things I noticed on here.
So specifically for radiation, patients have to make a choice. They have to go to Eden, which a large portion of our patients prefer because of travel time and access. Some patients will choose to go to Wesley Long. It's the same group of radiation oncologists that staff both facilities.
Right. So basically what's here is the chemotherapy.
Correct.
Which can be the most invasive and the...
Well, it's definitely the most, the radiation...
Well, not invasive, but
right.
Debilitating, I think was the word I was looking for.
Correct. Radiation is very time intensive in that it's a daily thing, but most patients find once it gets started, they're in and out. Chemotherapy is something that extends over a long duration, so many months, many visits, and for patients, like I said, it's a huge financial, also physical burden because they're already fatigued and not feeling well from their treatment.
If there's a patient out there listening to us right now and they would like to know more about Annie Penn's Cancer Center, how would they go about getting that information?
So Cone Health on their internet site, of course, there's information about Annie Penn's cancer program. There's information about myself and also some of our staff. And there's a phone number there. If people want to find out more, they can call us. And
as an end to this, I would like for you to tell folks where you came from. Because you came from a little tiny place just like this did.
I did. I spent my time after training in rural Mississippi to help them develop a cancer program in their community. And when I first started there, we were in the back of a very small building with only a few chemotherapy chairs. And when I left, there were several medical oncologists, and we had 25 chemotherapy chairs. So we really built a strong program for the patients in that small rural community, and it was a very great experience for me.
So you hope to do the same here for us?
Would love to do the same here for Annie Penn, definitely, and for Rockingham County.
Thank you, Dr. Penland. All right, folks, you've been listening to Dr. Shannon Penland. We're at the Cancer Center right here at Annie Penn, part of the Cone Health system, and we hope eventually we will be able to bring you a few more updates as we go through the year. I'm Debbie Moore reporting for Star News.